Steve Dale at the American College of Veterinary Internal Medicine Forum, hearing these amazing pet survivor stories. Many of the survivors had cancer, and Dr. Louis-Philippe Delormier from Montreal.
Hi.
We hear the word cancer so often as pet owners. There isn't a person who doesn't have an experience with their own family member at some point with that word, with cancer, or with pets that we've previously had. And if you go back 10 years, the outcome isn't necessarily what it is today. So as a part of your job is to stop the pet owner, if you will, from thinking the way we inherently seem to think about cancer.
I think we do. I mean, there's lots of cancer out there. Sometimes people don't think it's as frequent in pets as it is in people. I like to say that anything that has cells and DNA can develop cancer, even plants, but dogs and cats do get cancer. Owners are probably more aware now that there are options, and there's definitely been a tremendous advances in the last 20 years to detect, for better detection, diagnosis and treatment of those cancers in pets.
I want to talk about all those things. Detection, first of all. Sometimes pet owners must notice themselves the particular issues that are going on, but sometimes not. And particularly with cats, cats are so stoic, they can hide their symptoms so well. By the time you detect something, or the owner says, oh, my cat's not eating, or whatever the symptoms might be, the cancer might be pretty advanced. One reason I want to know how you feel about this, I'm a huge supporter of twice-a-year wellness exams, because you have equipment and expertise that can detect where even the most observant pet owner might not be able to.
Exactly. I think that's a good point, because sometimes we say, one cat year or one human year is so many years and things like that. And it's sort of true for many of the diseases we see. They tend to have, if we speak about cancer, they tend to have similar diseases, but sometimes more aggressive or more rapidly progressive, I should say. And if you detect it earlier, sometimes even with crude methods like radiology or things like that, but if you see a solitary lung nodule, like a mass in a lung in a dog, it's better if you detect it incidentally than if you detect it a year later and the dog is coughing or having fluid accumulating in the chest. And twice a year is still not that often, because they do things happen fast sometimes, and I've seen sometimes even faster than that. I don't want to tell people they should go every month, but I think twice a year is probably a bare minimum, especially when they pass a certain point, what we call geriatric or senior pets, or above, maybe say for large dogs, probably above 4 or 5 years of age, they should consider that, and for cats and smaller dogs, maybe above 7, 8 years of age.
Chase Away Canine Cancer, tell me about that.
Chase Away Canine Cancer is a foundation that's raising money to help find more about cancer. So it's basically a foundation that will raise money to fund some studies and help people that own pets with cancer.
To find a veterinary oncologist near you, check out ACVIM.org. You can also learn more about Chase Away Canine Cancer. That's something we all want to do. Thank you very much, Doc.
Thank you.